Can I use this video for educational purposes on the internet?
Yes.
Okay, thank you. So let's start by talking about your first procedure, your cervical procedure.
My cervical procedure was during COVID. It was 12 of 2020. It was an emergency C-section. I had been misdiagnosed for many, many years. They thought I was losing my hands. It was red flag and I was going into claws. The state of Minnesota, State Services for the Blind and DEED, was trying to teach me how to do computer skills for my business without my hands. Cardiology couldn't find what was going on, and then when Dr. Abbasi reread the films from another facility, he found that I was rubbing on the white sheath of my cord on C5, 6, and 7. And then we fast-paced that year to get that area fixed. I was completely surprised because I didn't realize how easy of a surgery this updated minimal invasive surgery is. I was told it would be a horrible surgery, I should never get it done. And when he told me it would be an outpatient, my head kind of snapped and I went, what? How can it be outpatient? And I'm driving home afterwards, with my husband. And it was a very easy surgery. And in the middle of that surgery, we also had an excellent anesthesiologist by Guerrier, I believe, Dr. Guerrier. He told me to get a 1-ohm test at my other facility. He says, you have genetic problems with anesthesia. And he says, we could not get your brain completely asleep. So we paralyzed your body, but we could tell your brain was awake. I have had medication issues and the family for years. And we have 2 rare conditions that are genetic that we do not process these medications. They're very old European family genetics. And so I've spread it around to all the cousins, and just recently, since I had so many areas that were not being addressed in my spine and my health care because of heart disease and statins had weakened them in some respect, we fixed the lower lumbar with an OLLIF, and that was done November 11th of 2022. So I had 2 surgeries in 20 months. And while Dr. Abbasi was in there, he says, you have a little scoliosis, I think we'll fix that too. So the first thing I noticed was that surgery, which was supposed to be worse, and people were all nervous about it.
The cervical?
No, this would be the lower lumbar.
Okay.
So we did the 2 surgeries. The upper neck one, the cervical, I actually was painting our cottage for my future daughter-in-law's family to fly in from Germany for the wedding at 6 months. So I had my hands restored and I could paint our cottage for them to stay.
Wow, and you do not hear about that 6 months after
6 months.
Cervical surgery, you're painting.
Right. On a ladder, painting and getting ready for a wedding.
Does Dr. Abbasi know that you did that?
No. So, but I finished that, and this whole group of military officers flew in. We did a wonderful private wedding for my son in cybersecurity, and then they all flew out. And then the next year I needed the lower back done, so we fit that in after my other son's surgery, my other son's wedding. So I have been able to get 2 back surgeries, put on 2 weddings for my 2 sons, and I have never felt better, and the surgeries were so easy. The second surgery, which I thought would be worse, actually was easier. So the low back was easier, and it had been going on probably since I'd had my son, my first son 30 years ago, because I had to start seeing a chiropractor immediately after that. I had a discrepancy, and I had a lot of clotting issues and problems during that pregnancy and the C-section. So it's amazing that I feel like I've got a 50-year fix on the top and the bottom. Life is good.
That's awesome.
And I am 6 months away from the last surgery on the OLLIF.
Okay, and how are you feeling 6 months out?
I'm feeling really good. I have a tendency to overdo it. So I was asking him questions, and I was asking about exercises that I could do so that hopefully I would strengthen and not, overdo it before I got my muscles back.
Okay, thank you.
So,
And so part of this testimonial, we wanted to talk about second opinions. To you, what is the value of getting a second opinion?
so I would not have my arms, and I was having vascular problems all over my arms and legs, extremities, because I did not get a second opinion. The minute I had my cousin's wife ask me, she said, "Mary, you have to have a second opinion." And I said, all right, because I didn't know what was wrong with me. And when your hands go into claws like this, I couldn't walk without my legs completely swelling up. My feet were another size bigger. They were 10.5, and I'm a 9 to a 9.5. And it was all based on collapsing onto the vascular system and the electrical system not getting out to my extremities.
Yeah.
So I thank her all the time for getting through my head, because I tend to be stubborn. So
it's that
and I have a lot of German in me,
It's
so
that
it's German and European. So she was very influential, and I highly recommend that you should get a second opinion. And it is so easy. And even my primary doctors, they brought all of the team of primary doctors out in this clinic because they couldn't believe at a month I was opening the door for them to walk through, and I was racing down the hallway and they had to keep up to me. So for me to be able to do that versus how they saw me walk is amazing.
Oh, I bet. I have 2 more questions. One of them is, how did you hear about us?
So I was recommended by my cousin's wife, Deb Anderson Stevens.
Oh, I know her. Okay.
Yeah, so Deb, she knew, and so we made a deal that I would try to help her husband, my cousin, to better health, and because she has done so much for me. So, gotta love these kind of women that, they just say, you gotta do this. And I'm like, yeah, I do. All right, fine, where do I go?
That's so cute. And one thing I always ask people, I think it's so important, is what are some things that you couldn't do before your surgery that you missed and you can do now?
I could not. I couldn't drive a car. I was losing the function of holding a car wheel. I could not hold pencils without dropping them. I had tremors. I had, like I said, claws, and then I would go into automatic spasms. I couldn't sleep well. I had sleep apnea. So the sleep apnea went away. I had visual disturbances. I had the legs swelled up. I had cardiovascular issues. The second in charge of thrombosis at a big major facility, they were thinking I had to be on blood thinners constantly because of the swelling in my legs were so bad. They thought I had lymphedema. Just a host of things. I couldn't move my toes. And after surgery, one of the crazy things is the toenails turned bright red on the tips. And I went to the doctor who had done some oncology on my one foot for Lederhosen, which is a cardiovascular condition. She said, "Oh, we haven't seen that in a long time." She says, you've revascularized your feet, and those are all the capillaries coming back. And they put a red circle right where the tip of the toenail bed is, right where you would have the nail to the nail bed.
Okay.
And it was all bright red. And she says, that's the capillaries coming back.
That's
And
cool.
they got to see that the first. So then they brought in all the other doctors and the teachers, and they were all excited. So the next one is we're going to see if this low back revascularization helps my colon health. So the GI doctors at this major facility that are in the women's health for GI, they want to see if that will set back my polyopsis syndrome and maybe revascularize my colon so it's healthier, like reversing things.
Yeah. Isn't it crazy how everything is just connected like that? Well, thank you so much for this.
Thank you.
Is there anything else you want to add?
No, and I just want to tell you how grateful I am that I was able to find a world-renowned surgeon, and he was close. and he has the bedside and the compassion that he actually cares about the patient, not about the money.
Totally.
So
That's